In the United States, as a medical doctor, you have to undergo a licensing procedure that is called the USMLE. Basically, the USMLE is organized into steps, and when you pass these steps, you can have access to the residency, what we call the specialty schools. What we are trying to do is to organize some courses through which our students can experience how they can learn how to answer to the question, which means they are exposed to some of the questions of the USMLE Step 1 specifically, and then they learn either individually or in group has to be able to acquire the capability to answer to this question. During these preparations that we are doing, we are helping our students to understand not only how to face the content and the question of the USMLE, but also how to enroll to the USMLE steps and how to understand the American system also with respect to the access to residencies.
The USMLE STEP examination tests material from the preclinical years of medical school as well as the clinical years of medical school. It's broken down into Step 1, which is the preclinical exam, Step 2 CK, which is the clinical knowledge exam, and Step 2 CS, which tests your clinical skills. They're very important. The USMLE STEP examinations are probably one of the top determinants of whether and where a candidate will match for residency in the United States. So the STEP examinations can be very different from the way that the styles of learning in other countries. In the United States, we have a lot of multiple choice examinations that we take. In other countries, they might not have the same exact multiple choice questions. A lot of the things we talked with the students about were new or maybe not covered in their education.